You need to unmute yourself. Dr. Kapur, you need to unmute yourself, please. Thank you. Now you are live now. Thank you very much. Good morning. Dr. Kapur is taking the class on incontinence today. You start when we're ready.
Namaskar. Good morning. Om. Jai Mata Di. Welcome back, Mohan Bhai and Kushalya Mata. You are all back now. Had a long break, I think, in America. Well done. We will start with the chanting of Om. Keep your neck straight, shoulder behind. Hands are in Dhyan Mudra. Om. Om Bhurbhuva Swaha Tatsaviturvareniyam Bhargo Devasya Dhimai Dhiyo Yonam Prachodayat. Om Sarve Bhavantu Sukhina Sarve Santu Niramaya Sarve Bhadrani Pashantu Ma Kashtit Dukh Bhag Bhave. Om Shanti Shanti Shanti. Let's all pray to Almighty, the Supreme Power, for the wellness of whole universe. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional, and financial. At the moment, there's a lot of financial crisis. So we are praying for everyone. Om Shanti, Shanti, Shanti. Thank you very much, everybody, asking me this very, very common problem of especially this age, the golden age. I don't know who asked for this. Again, many are suffering, even the men and the women, and some children. And there are so many reasons, and there are so many types, which I'm going to cover. Before that, I'm going to do a little bit awakening up ourselves so that we can concentrate on the subject. So do some soft, gentle exercises, very easy. Very good for the rheumatoid arthritis, small joint arthritis, pins and needles, pain in the hand, even the grip is going and going. Can't hold anything. Because of this arthritis, we are throwing things every day, spilling the things. So try to do like this also. And we are doing our Patrika Pranayama also at the same time. Go on breathing in and out from the nostril. This is all our diaphragmatic breathing, not abdominal breathing. Carry on. Breathing in and out. Again, please keep in mind all the precautions. Do as much your body allows you. Some days we are very active, other days we are not. Hypertensive heart problems, severe acidity, severe asthma, severe backache. Do everything slowly. Whether you are doing a pranayama or the exercises or the poses, whatever you are doing. So follow your body. Then you can take your arms down. Going down, we are breathing out from the nostril. Coming up, we are breathing in. Exhale, inhale. Exhale is your rechak. Yes, breathing in is your purvak. Exhale, we call it rechak. Inhale, purvak. Then make a fist, tight fist, and stretch your arm at the shoulder level. Stretch, open and close. You are making your Adi Mudra, the first mudra. We had this mudra when we were in the womb of our mother. This mudra. मुट्ठी बांधे आए जगत में हाथ पसारे जाएंगे. मुट्ठी बांधे आए जगत में. Then stretch again as much you can. And do like this more. Do it every day. Well done. Then you can do like this. Up like this. Hold it. Stretch your arm. The effect is going to many parts of the body. One movement is making our body move whole. That is the beauty. All the muscles and the joints, even you're getting the effect on your shoulder, your neck, and upper part of your chest also. Going down. Whether you can do gentle, we are just warming up. Go on breathing, Patrika Pranayama, with a smile on your face. I am increasing my oxygen level, which is going to help me to activate all my system. Oxygen. Even get rid of pain also. Then side stretch at the shoulder level. Stretch. This is going, oxygen going to increase my central nervous system. Get rid of my anger, greed, enmity, ego, competition, and good for dementia, which is so common nowadays. Then you take your arms up, 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 stretch, stretch. Then bring it down, up again. Go according to your own body. Some of you are very active, so you can do fast. Very good. Very good. Very good. You can do any pose, any pose. Start slowly, medium, and then fast. Some of us are quite active by 9 o'clock, if you get up early. Yes. You might have done some work in the house even. This you can do. Carry on. Reverse. Very good, very good. Other one, you can do any stretching. Up, then go down like this, sideways. You are activating the area which we are going to talk about today by doing this also. So many poses already we are doing to activate the area which is giving us problem. And talk of the day, urinary incontinence. Then come up slowly. Again. Well done. Carry on. Stretch. Stretching is very important for the bones, for the ligament, for the muscles, even for weight reduction. Very good. Well done. Quite active, isn't it? Give some laughter. That activates so fast. To increase your prana, come on. Get the prana from the nature, more and more and more. Thank you very much, everybody. Thank you. Thank you. Now we are going to talk about the subject of the day, urinary incontinence. Please try to look at the picture I put it on. Try to focus on that first. You are seeing some red things at the bottom of this pelvis. This is known as pelvis. And you are looking at the bones lower down up to the last bone, which is called, we call it bottom coccyx. Coccyx, this bone. This is the end of it. Now you are seeing this like red carpet, isn't it? They are the muscles, the levator muscles, our pelvic floor muscle. These are the ones which are controlling our urine or our fecal matter also. People get fecal incontinence and urinary incontinence. These are the ones. So we are focusing in these. These muscles start at front edge of pubic bone, you can see. And the last one at the back is the last bone, we call it tailbone. Coccyx, the name is. So
Dr.
those
Kapur,
muscles are going
Dr. Kapur,
around your pelvis.
Dr. Kapur,
They
you
are
have to
like
point the
a sling.
you have to point the screen rather than the computer. We can't see you, but you're pointing.
Can you see now?
No, you have to point the screen. If you point your screen,
Now
your
the
TV
thing
screen.
is, if I point, then it shakes, you know.
Okay,
Try to concentrate the front part, and that you can see the red thing lining down in the pelvis. So it is starting, these muscles starting from the front at the pubic bone. That is the lower part, you know. Lower part, I will show you in a minute. And going to the back, known as the tailbone. That is, and this is like a, you can say झूला. झूले की तरह है ये. स्लिंग या हैमक कहते हैं इसको. ये झूले की तरह है जिसके ऊपर हमारे ऑर्गन्स रेस्ट कर रहे हैं. Like your bladder, urethra, जो ओपनिंग है यहाँ से यूरिन बाहर आता है, and your uterus, and in the man it's prostate. They are all resting on this, you can say this red area. That is known as pelvic muscles. Now मैं आपको अब दिखाती हूँ. आप इसके ऊपर concentrate आपने कर लिया इस muscle को. That is very important. Where it is located, that is important. This is the lower part. These muscles are at our sitting bones, you know. Now these are the ones, when the problem occurs, these occur with these ones. So let's move over. I will show you where is the pubic bone and what it is. Now I'm standing. This lower part is pubic bone. So the muscles are starting underneath, going lower part of my last bone known as the tailbones, or we call it sitting bones. Okay. So this is the one which is creating the problem. Now, urinary incontinence means you can't control your water and you are leaking your urine. You are leaking your urine, which you don't want to do, but you are leaking, that is urinary incontinence. You have no control of your urine. You are passing urine, and there are so many reasons for that. Normally, people talk about stress incontinence because that is far more common. Stress incontinence is when you laugh, stand up, carry heavy weight, sneeze, or cough, there is a leakage. Some amount of the urine comes out without our wanting to be doing it. So that is your stress incontinence. When the stress is increased, because normally the urine go on collecting in a sac known as bladder. Bladder. Go on collecting there, and when the right pressure comes, then the opening opens up. There's a tube which is known as urethra. The water comes through there outside. So when you are having stress incontinence, that means there is some weakness of that urethra, which is a sphincter, that is a controlling power. Otherwise, it will only open when it is healthy, when there is enough urine and you are doing. So the stress is being increased because we are coughing, laughing, lifting heavy weight, and other things are like when there is a damage at that area, and that's why it's very much common during pregnancy, at the time of delivery, childbirth. When we have vaginal delivery, and if the labor is too long, and then they have difficulty in passing, and the child is quite big, lot of pressure comes on those muscles which you have seen, the red carpet I was saying. They get lot of pressure. And if you are overweight, again pressure increases. And if there is a damage to the bladder or to the urethra, which normally happens when we go for surgery. In the woman, it is not that rare to see after hysterectomy when they remove your womb for any reason, or in a man when they go for the prostate operation. Man has also got this big problem. Enlargement of the prostate, cancer of the prostate. When they go for the operation, unfortunately, there may be some damage to the nerves and that muscles which is holding our sphincter. So this is very important. And sometimes we get this when we have these neurological problems, Parkinsonism, or multiple sclerosis, because the nerves which is going to give the message from the brain to the bladder, they are not working. So these are the reasons why it is happening. So this is one type I mentioned. Another type is known as urge incontinence, which you might be feeling many times. We are going shopping, suddenly we come home, we are opening up the door, and urge is coming to pass urine. For that, there are so many reasons why it is happening. Our bladder is rather irritated by taking lots of tea and coffee and Coca-Cola, even the green tea. That gives a lot of urge on a bladder. Bladder muscles, they get irritated. So they get urge to pass water. So this happens then. Or other thing is when we are not drinking enough water. So what happens? Our urine is very much concentrated, and that irritates our bladder muscles. And again, the urge comes to pass the water, and the leakage is there again. So we have to make sure that we drink enough water so that our urine is diluted, not concentrated. Other thing is when we take this low fiber diet and we land into constipation. So have enough high fiber diet, lot of green vegetables, all the pulses, so that there is enough fiber in the body. So this is known as urge. There is urge, sudden desire to pass water. So we have to control that. Sometimes this happens when we have urinary tract infection also, which is very common, especially in women at this age. Because of our anatomy, we are made like that, different than men, So we get more urinary tract infection and we get the urge to pass water. Again, there are so many neurological conditions also. And you know, the diabetics also suffer quite a lot. Again, sugar is too much in the urine. That is creating. Then the other, you might have heard, overflow incontinence. That means your bladder is not emptying every time fully. Some urine is retained in your bladder and then it overflows. And this is much common in the man because he has got enlarged prostate problem. Because there is an obstruction. Enlarged prostate is blocking the passage of my urethra to pass the urine out. So this is a blockage on the way because of the weight of increased prostate gland, because they are just sitting at the neck of my bladder, man's bladder rather. Then they can bladder stones also. Sometimes people get cancer also. So these are few things which we have to keep in mind. The man is going around in the toilet maybe 4 to 5 times because there's a urge sort of and overflow incontinence. There are mixtures of so many problems. That's why they have got this problem. So please watch out for this and go and have done your investigations why it is happening. And the other one is known as total incontinence. Poor soul is leaking all the time, all the time. This is known as total incontinence. For that, the reason is maybe you are born like that, birth defects in the passage of your lower urinary tract. This can happen. Or after surgery, you have been damaged, your nerves are damaged, your muscles of the bladder and muscle around the urethra is also damaged. So you can have total incontinence. Total incontinence. Some people are suffering. I know some of my friends have this problem. So please watch out for these things. And other thing is there are some risk factors. First and foremost is age. As we are growing old, our bladder is getting very weak, like any other thing, like getting wrinklings, losing weight, getting smaller, weak. Everybody say you're very weak. That is an age effect. Same thing goes on the bladder muscles. They are getting weak and we are getting this incontinence. And then this is hereditary also. It runs in the family, which we can't control. Yes. Then as I mentioned, the urinary tract infections that can increase this problem which is going on. And even in young women also, they are getting a lot of urinary tract infection. Because so many reasons. The constipation is first and the foremost. And plus their hygiene. That is very important. Hygiene is very important. How to clean yourself down below. Yes. Always do front to back, not back to front. This is important. This is hygiene. Always clean when you're going to the toilet for passing urine or fecal matter. Always clean from front to back. People do sometimes opposite, from back to front. Then they get infection. Because there are so many bacteria in your gut, which is going to go into the urinary tract system and give you infection. So that it's very, very important how you clean yourself. And then the other things which we are facing today is some of the medicines, they are giving us this problem. You know, diuretics you get for high blood pressure, you get diuretics, Lasix and whatnot. That can give you. That's why the people that are trained what time to take their diuretics. And that they can control their urine much better. Then there are some treatments for the high blood pressure tablets. ACE inhibitors, they are also one. So if you are suffering from this condition, or you are having antidepressants, you are having sedatives, please watch out. And again, in the reproductive age, the woman, if she's taking hormone replacement therapy, please, if you have got these symptoms, check with your physician, and if they can look at your list of the medicine you are taking, that might help you. They can give you something different to control yourself. Now, what is the complications? There's a very big complication of this. People are embarrassed. They don't talk about this. I know that. Being a female doctor, as a gynecologist, I know this problem. They hardly talk about this. I don't know much about men, because the men were looked after by my husband in the practice most of the time. But the women, as per they were concerned, they won't come and talk even to the lady doctor. But you have to get that point somehow or other, from them. I don't go much out. Why don't you go much out? Listen, I leak. I don't know if there is a toilet nearby. And many places, there's no toilet nearby in the shopping centers even. And even if in the mall there are toilets, they are not very near. They are not very near. Sometimes you walk a lot, and when you're walking, you're going to leak. Naturally, you're going to leak. If by chance you cough, sneeze, you are leaking then. So that's why I don't go out. That's what they used to say. I don't go out. I just stay at home, because I'm leaking. And some of them have difficulty in the workplace also. Maybe some are not going to work because of this problem. And other thing is personal relationship that is damaged. You can understand that. What is that? And other thing is we can't socialize. And if you are having leakage very frequently, what will happen? You will get skin infection. You will get skin infection because the area is wet. So be very careful if you are having these problems. Again, you can land to more urinary tract infections. So please, please watch out for all these symptoms. I told you, mainly there are 3-4 types of urinary incontinence, not one type. We talk about, because we are dealing with women most of the time, we talk about stretch incontinence, which is much common in the woman. And then come your urge and overflow, that is more in the man also. They are not spared. They are also suffering from this problem. Again, they don't talk also. Please be open. Idea of my giving you this little introduction to the problem is giving you awareness. Awareness. Please don't ignore yourself. Go and talk to your physician and get better. Because there is a lot of prevention you can do. There are certain conditions we can't prevent, but majority of them, if we look after ourselves, we can prevent it. And to prevent it, so easy techniques are there, so easy. We are doing yoga practice every day. We are doing pranayama, our asanas and our physical exercises. They are going to help us. I will be covering not all, some of the most important one. But before that, what is the treatment? When you go to your doctor, what he will say? He will listen to your story, he will examine you, and then he will diagnose that you have got pelvic floor weakness, which we all had after our delivery. We were encouraged to have postnatal exercises. But how many did, I don't know. They were mainly meant because there's so much stress on your pelvic floor muscles. They get weak, they got stretched because the baby is coming through during the childbirth. And in the late part of pregnancy also, they are having stress incontinence. So that's why we are always advised to have postnatal exercises. Very, very simple. We are going to activate our pelvic floor, which is like a hammock. झूला है नीचे झूला, उसको हमने strong करना है. उसको strong कैसे करना है? And there is a technique how to do it. Most of the time, when we do our yoga practice, you do mool band. Yes? You do mool band. Here also you are doing your mool band. But there is a certain method how you do it. Now I can now start that. Now you sit in any relaxation position, whether you're on the chair or you're lying down. Even when you're standing, you can do it. And this is known as secret exercise. Secret. छिपी हुई है ये, किसी को पता नहीं लगता आप कर रहे हो वो एक्सरसाइज, छिपी हुई. Secret exercise. So we can do now. Please start doing it. Sit straight, relax your body and the mind. Do mool band. As if you want to go to pass water and the phone is ringing, just tighten up your muscles at the sitting bones, which I have shown you on that picture. Tighten that up. Hold it maybe in the beginning 5 seconds, 10 seconds, and then you relax. Hold your sitting up bones muscles, the pelvic floor, they known as levators. Hold it. Number 1 exercise, you're holding tightly your muscles as we do mool band. Here the precaution is, as we do our Bahiri Pranayama, we do 3 locks. Here you are doing only 1 lock with the precaution, don't hold your breath. Over there, sometimes we say hold your breath when we are doing the pranayama, Bahiri Pranayama. Here, please don't hold your breath. Don't squeeze your legs and be relaxed at your bottom, also the buttocks, because the muscles are different for these actions than these pelvic floor muscles. No holding of breath. So we have done. The second one is, we are going to do a little bit fast now. Again, tighten up your muscles, the pelvic floor muscles. Hold it for 1 second and release. Then relax. You have to relax in between. Don't go on doing it continuously. Hold it. 1 second, release. Hold it 1 second, release. It's very difficult on the Zoom, but if we are face to face, I can see you and you can see me also. So these are 2 ways to do it with the precautions. Other thing we say, not to get this accident of leakage of urine, what should you do? It is happening when we are lifting heavy weight. Sometimes we can't avoid that. We have to carry our shopping. We love shopping, you know. That's the problem. Carrying that. During that time, do this pelvic floor exercise and you will see the leakage is controlled. When you're lifting something and during laughter, it may not be easy. Other thing, the people who are suffering a lot of this leakage problem, they should not do jogging even. And even don't do yoga, that is poses of laughter with this, because otherwise you're going to have leakage, definitely. Because wherever the internal abdominal pressure is increased, leakage will come. Whether you're overweight, you're constipated, or too much increase in the abdominal pressure. So that's why when I do yoga session, I gave them lot of warnings, because I have learned from my own experience. I say, if you are suffering from urinary incontinence, be prepared. You might have a leakage. That means you put some pad there. Tina pads you can use. There are so many pads available. You can use those pads, but don't ignore your laughter yoga. You have to laugh. So I tell them, be careful if you have got stress incontinence, fecal incontinence, because abdominal pressure, when we do lot of laughter yoga, and maybe the exercises, the asana, like your Markat asana, the bandar pose, how much we are moving, you know. So if you are having urinary incontinence or fecal incontinence, there will be a leakage. So that's why we have to prepare ourselves. There's nothing to be shy about it. We are all suffering. We don't talk about this. Okay, the next one, we are coming to go back to our own yoga practice. Swami Ramdev yoga practice. Okay, I think I will cover quite a lot. If there's any question, you can ask me at the end. I made it very simple, various types of urinary incontinence. Usually we think it's only stress incontinence. No, no, no. Urge incontinence, complete incontinence, overflow incontinence. So these are the various things. So we have to watch out. Now we want to prevent this. Or if I am suffering, I want to get better. So this is my therapy. We have done this pelvic floor exercise, another one known as the bladder training, which is done by the discontinent nurses. You are referred or you can make your own appointment. Sometimes there's no need of referral from the GP. In that, they give you bladder training. You make record how often you're going, and they encourage you to try to hold so that duration is increased. Otherwise, you're going to the toilet again and again and again. So bladder training is a very specialist. Instructions are given for that. So if you have got this problem, pelvic floor exercise you can do yourself. For the bladder training, you have to go to the expert to get the training. And they are special nurses for this, known as continence nurses. And in every area, I'm sure, because people are looking after us, for the incontinence, because it's a big problem. So going back to our pranayam, we are supposed to do all the pranayam. We start with Patrika Pranayama. Keep your neck straight, spine straight, shoulder behind. Man sahaj, aankhein band. Go on breathing from the nostril, exhaling from the nostril. Now there are so many causes for having this. Overweight. So we have to do the Kapal Bharti to decrease our weight. And then activate. We are moving our fast now on pranayam. Bhadrika you have done. Next one is Kapal Bharti. This is very, very important. Here we are going to get rid of our physical problems, as incontinence of urine can be because of my diabetes. Yes. Or I am overweight, so I want to activate my thyroid gland also. That is controlling my metabolism. So we are doing Kapal Bharti, keeping in mind all the precautions. We don't do during pregnancy. After major surgery, we don't do 4 to 6 months. Even after minor surgery, we start doing on the instruction of yoga teacher or your physician. Which one to do, how long to do. You can do with your mudras that give extra, flow of your prana. So let's do, first of all, we will do this one, Vayu Mudra. Then change over to Apan Mudra. You are doing physical exercise also. And Kapal Bharti, detoxification of all the system. Activating all the internal organs. Well done. Next one you can do Apan Vayu Mudra. Carry on. Kapal Bharti is first and the foremost. Surya Mudra, weight control, activation of all the organs. Surya Bhagwan ki jai. Next is your peak mudra. I want to balance all my three dosha, Daka, Pitta and Vata. Peak, Samana mudra. That will control so that my weight will be also controlled. My pain will disappear. I will be more happy and cheerful. Control all the three dosha. Do it at your own pace. Take your mind to the problem. Now, urinary incontinence. So take your mind to your bladder and lower part, urethra. Concentrate there. And say yourself, I am getting better. I am. People are getting better. I have few in my classes because I deal with the senior citizens. Most of my sessions are with golden age people. They believe in gold. They are getting better. So I will get better too. Positive thinking. I am getting better. So I've done some of this because time doesn't permit, otherwise you can carry on. Other one is your physical exercise. As you're sitting on your sitting bones, so you are activating your pelvis muscles. Go on doing Chakyasana. I am obese. I want to lose weight. I don't want to suffer from stress incontinence. Go on doing this at your own pace. Precaution, don't bend forward if there is a backache, heart problem, hypertension, low blood pressure. These are important factors one has to keep in mind. And don't go back if there is hernia, ordinary hernia or hiatus hernia or acid reflux. Carry on. We want to lose weight. That is giving me problem with my stress incontinence. Then you can do churning also. Make charge. That is good for me. Charge. Move your legs also. Go on breathing. You're doing your Patrika Pranayama. Very good. Spread your legs. Touch the opposite feet with the hand. Sitting position is very good actually. For this, take your mind to your pelvic floor muscles. The red carpet I show you in your pelvis. Carry on. Very good. Next means Shashakasana. Breathe in, stretch. Stretch, look at the ceiling. Then you go down. Then you go down. Look at the floor. Come up. Stretch again. The rabbit pose. Come on. Stretch. Stretch. Take your mind to the pelvic floor. Dhyan Purvak Yog. Then exhaling, go down. Then breathe in and come up. As we are sitting, you can do your Gomukh Asana also, cow's pose. See? Because you're sitting. While you're sitting on the mat or on the chair, very good for the pelvic floor. And the shoulders, multiple benefits. We are concentrating today at our pelvic floor muscles. You can look up. Now stay in this position, not only 5 seconds. You might have stayed for maybe 1 minute at home or 2 minutes. But during these sessions, we can't spend a lot of time. We move, we move, we move. Charaveti, charaveti, chalte chalo. Then relax. Other side. Make sure the knees are in a line, you know. Release. Next is Wakarasan. Right knee is bent. Left leg is stretched out. Holding my right knee with my left hand and the right arm is going behind, close to the body. And I'm looking on my right hand side. This is going to activate all the internal organs, the left side of my chest, my lungs, my left kidney, adrenal, plus lot of stress is coming down below also. As I'm sitting straight, neck is straight, spine is straight. Only I am looking on the right hand side. Then you breathe in and look straight. Other side. The left leg is bent, right is stretch out, stretch, stretch. So the effect is coming at the pelvis. And I am looking now towards the left side. Again, you can do Kapal Bharti also. That added benefits. With any pose, you can do Kapal Bharti. Well done. The next one is Yog Mudra Asana. Left hand at the umbilicus, right at the top. Breathe in and go down. Imagine your chin is touching the ground. See, you are giving enough exercise to the pelvic floor. Plus other benefits, of course. Good for your brain also. Take away the stress, dementia, increasing the circulation of the brain also. Then come up slowly. You can do another way. Hold your hand at the back and breathe out and go down and raise your arms up. Then come up slowly and release. Never forget Mandukas, which we are doing every day, isn't it? To get all the benefits. Breathe in, breathe out. Free your stomach in and go down slowly. Look at the ground. Then lift your head up and look straight. You can do Kapal Bharti for weight loss, get rid of constipation, any gas, plus activating of all these organs of the abdomen, pancreas, liver, gallbladder, spleen, kidneys, intestine to get rid of constipation. Then you breathe in. Second pose, left hand at navel, right at the top. Breathe in, breathe out. Squeeze your stomach. You can control much better like this. You are activating your Manipur chakra, which is going to control the whole things of the abdomen. Look down and look up. And Kapal Bharti. Well done. Come up. Now, while sitting on the mat, on the chair, you can do your Paschimottanasana. Breathe in, stretch, bend forward, Paschimottanasana. Very good for the pelvic floor and for the core muscles also. Come on, hold it. Head down. Good for the spine. And come up slowly. Now, while sitting on the chair, try to do with the both legs. If you can, don't have a fall. First, take arm stretch like this. Breathing in. Now, breathing out. Going to touch my part of my lower limb, any area. Your thighs, your knees, or you are touching your toes, depending upon the flexibility of your body. This is very good for the pelvic floor also. Okay. Now just relax again. Before starting other standing poses, lying down poses, I will tell you one thing more. Another mudra. Ashwani mudra. Ashwani means horse. Mudra. That we are, when we are doing our passing the stool, we close our anus. Stool is going and close. Ashwani mudra. That is going to activate my pelvic floor. Plus, this is good for indigestion, for constipation. When you're passing stool is going, then close that sphincter. Anal sphincter, that's known as. Yes, control this. This will also help us to activating my pelvic floor. So this mudra is very, very important, known as Ashwani mudra. If you ever seen horses passing stool, just you might have seen, but otherwise just imagine passing stool and then controlling your anal sphincter. Open and close, open and close. That will help you quite a lot. Now, other thing which we are doing every day is your chair pose. We are increasing our nitric oxide also, causing the dilatation of the blood vessels, getting rid of so many problems. So we are doing the chair pose. This we do for the nitric oxide. Yes, every day we are doing this 3-4 poses. Now here I am doing the chair pose. Buttocks are out. So how much exercise being done on this sitting bone muscles? So this is very important. Do like this. Chair. Imagine we are going to sitting on the chair. Chair pose is very, very important. Okay. Now standing, your Tadasana. Just do like this. So many other benefits will come with the Tadasana. Get it up in direction. Good for heart. And for my pelvic floor muscles also. And in children, increase the height. Stay like this. Then come down. Straight Tadasana. Sideways bending. Your pelvis is moving, isn't it? So those muscles which are in the pelvis, they will also move. You can spread your legs. Very good. Very good. Okay. The next one is your Padhastasana. Breathe in, stretch. Go down, keeping in mind all the precautions. You can touch any part of your lower limb or your toes. When you come up slowly, go back. Just focus on your pelvic floor muscles now, which are in your pelvis. These muscles are very important. They are doing a lot other works also, besides this incontinence. They are increasing our flow of our fluid in the body, and that fluid is going towards the heart, and those blood vessels are taking all that and purify our blood in our lungs. So they are doing a lot of work. Then you go down slowly again. First up, we're written on Padhastasana. Pad means feet, Hast means hand. Okay, take it by the side. Now, so many exercises you can do while you are lying down. We are doing every day, every day. Very good. Let's lie down. Take your time. We are lying on our back. First of all, we'll be just lying down. Make sure your body is touching the ground nicely. Relax also. You can do your chanting also. Mantra japa. We are preparing ourselves for further exercises. Asanas. Relax. Then start with the legs. Raise your legs up at 90 degrees. Hold it, stretch it, stretch. Take your mind to the pelvic floor again. The left one up, breathe in, go up, stretch, stretch 90 degrees. Hold it. Sorry, there was a sound coming. Lie down. So this is giving so many benefits to my pelvic floor plus weight reduction. Now try to raise both the legs up and hold it. Hold it. 90 degree. Hold it. Hold it. And bring it down. Very good. Slowly. Again, raise your right leg up. Make a big circle. 360 degree. Breathing in and out. Patrika is going on. Side by side. Clockwise. Then anti-clockwise. At home you can do for longer time, 100 times. Here we can't do. Take it down. Left leg up. Rotate. Stretch the leg. Stretch. Don't bend the knees. Stretch. Stretch. Anti-clockwise. First clockwise. Anti-clockwise. Carry on. Your body, your time. Then you can do with both the legs. But don't do it if you've got brittle bones or any heart problem or you're feeling very weak. Do according to your own body. Clockwise, anti-clockwise. Then bring it down. Same thing you can do cycling. All those exercises we are doing every day. Reverse, going back, the other leg. Very good. Stretch and we are on the bicycle. Reverse. Then you can do with both the legs. The next one is Bhadrasan. This one. You're joining up your feet. Joining up your feet. Joining up your feet. And lying down. As we do butterfly, here we are not moving our knees up and down. We are resting them down. Very good for the pelvic floor. Just lie down. Join up your soul. Bhadrasan. You can do this while sitting also. Butterfly without flying. Just joining the soul. Try to rest in this position. This is very good for the pelvic floor, plus give you a lot of relaxation also. The next one, threading through the needle like this. My right leg is resting on my knee. And you can hold like this. Then down. Now, the left leg is coming on the right. The right knee is bent. And I'm holding like this. Very good for the pelvic floor. Then relax. Or you can do like this also. See, right leg is coming this way. Then breathe in and take it up. Then down. Breathe in. Take it on the right side. So that there is a movement in your pelvis. That's the idea. Relax. Now that's why we are doing our Markatasan, Markat, Bandar pose, 3 poses that give a good exercise on our pelvic floor. Arms are at the shoulder level, knee closed, feet closed, take it on the right side, and I am looking at my left hand. Then you breathe in and come in the center. Now knees are going to the left side. And I am looking at my right hand. We do this every day. Bandar pose. Markat asan. Monkey pose. Then come in the center. Spread your legs about 1.5 feet. Take the leg on the right side. And I am looking at my left hand. Then you come back slowly. Now take the legs on the left side. Now here you can look. One knee is touching the ground. Another knee is resting on the opposite sole. Or the heel, you can say heel. And I am looking at my right hand. My arms are at the shoulder level. Here you can do your Patrika Pranayama, or even if you are very active, you can do Kapal Bharti even. But follow your own body. Getting the extra benefits. More hard you work, more benefits will come. Then come in the center. The next one is again, raise your right leg up, 90 degree stretch, and then take it on the close to your left hand. And I am looking at my right hand. So side by side, you are doing your neck exercise also. And don't move your neck if there is a neck pain. Follow your own body. Stay in this position for a long time. This is the best session, best pose for the many problems, for the backache, activating the pelvic floor muscles, weight reduction. Stay in this position comfortably. Then breathe in and raise your leg up 90 degree. Stretch again. Then bring it down very slowly. No rush. Left leg up, 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 90 degree. Hold. Then take it towards the right hand. And I'm looking my left hand. Very good. Stay there for short time. You can do Bhatrika, Kapal Bharti even. And breathe in and bring your leg up. 90 degrees stretch. And down very, very slowly. Next one is your Uttan Padasana. Only you're raising your leg 30 degrees. You can do one leg or both the legs together. How much strong you are. Do at your own pace. Left is up, down. Right is up 30 degrees. Very good for various other problems. Nadi dharan, displacement of the solar plexus. Bring it down. Raise both together at 30 degrees. See how much pressure is coming on the pelvic floor. Then take it down. Then you can do your Wakarasan. Very good. We have to move over. Next, coming to Setuban Asana. Very good for various problems. Raise it up, up, up. Stay there for some time. Setuban Asana. Well done. The next one is we are doing holding our feet. This is a variation. Hold it like this. Hold. Hold. Hold it like this. Hold it like this. Hold like this. You're just holding. I am holding the bottom of trousers and pulling it up like this. See? So easy. Just hold. Then comes to your everyday Pavan Muktasana. Pavan Muktasana. Take it down. And give a good rotation. Give a good rotation forward and backward. Sideways. Pavan Muktasana is very good. Simple to do it. We don't have to do difficult poses. Well done. Just relax for a short time. We are in the Shavasana. relaxing the whole body. Always rest in between. This is also going to relax my pelvic floor muscles. You can do meditation, you can do yoga, nindra. Relaxation is most important. Good. We can't carry on. We have to do 2 or more poses. The cat and the cow's pose is very, very important. See, we are here like this. The cat one is, you're lifting up your spine and looking down. And you're getting exercise on the pelvic floor also. Stay there for a short time. Then raise your head up. The stomach is going down. Very good. Down again. That cat we are now. Now we are Gau Mata Ki Jai. Very good. The next one you can do, raise your legs up on the wall. On the wall. Let's say, look at this now. Imagine this is my wall. This is my wall. When we are tired or we are very, very edgy, raise your legs up on the wall like this. Relax your muscles completely. See? This will help my pelvic floor muscles also. Stay like this when we go for a long walk, especially on holidays. We'll get swelling of the feet and the ankle and the legs are sore. Just stay like this. This is very good for the pelvic floor also. And again, you can move your leg on the wall. Imagine I am on the wall. Okay. Other one, this side. Yes. Then you can come close and bend your knees. Bend your knees. See, very good for the pelvic floor. Very good. For various other conditions also. This is a very, very beneficial pose. Raising your legs up. If you can't do on the wall, do on your headboard of your bed. Headboard of your bed. Or a chair can also do. You can put your legs on the chair. Idea to raise your legs, get rid of any swelling, any pain, good for varicose veins also, and good for a lymphatic system, blood system, and for my pelvic floor. You can stay like this, relax your body and the mind. Well done, my friends. There are so many more things you can do. Take the left turn and get up. All the pranayams are important, out of which you have to do more Bhadraka, Kapal Bharti, Bahari Pranayam. Bahari Pranayam. And in that, I think you should do more spending on your Mool Band. And when you're doing only that Mool Band, keep in mind the precautions I mentioned. Don't hold your breath. Don't squeeze your legs. Relax. The next one is Alom Vilom for short time. Increasing the oxygen level in whole body, all the systems. To every muscle, they're getting more oxygen to get rid of their problems. While doing Alom Vilom, my attention is to my pelvic floor muscles, which you have seen in the pelvis, like a hammock, sling, or jula. Alternate nostril breathing, which is going to control all the systems. Any disease and the complication of that particular disease, we are getting rid of. Other thing is you can do your Kriya. Agnisal Kriya is also going to help us. For the pelvic floor, get rid of urinary problems also, tightening up all the muscles of the pelvis. So that's why we should do Agnisal Kriya. You can practice at home. Again, the same is breathe in, breathe out, and move your stomach forward and backward. And plus this will balancing our weight also nicely. Agnisal Kriya is very important. So many benefits. And while sitting, you can do your butterfly also. Or while sitting on the chair on the mat, you can do butterfly, but I think we have done enough. And other, there are more complicated. You don't have to do that at this age if your body doesn't allow. Like Sarvangasana, when it is the shoulder stand, you don't have to do that because there are certain things which can give us side effects. Our bones are very brittle. We have covered that osteoporosis. So we know we have to be very gentle with ourselves. Or you can't do that halasan, No, that is not for us. If you are young and you practice your yoga at an early age, your body is flexible, then you can do it. Otherwise, do some of these simple poses, which we are doing every day, plus do pranayam. Spend more time on pranayam. That is the first and foremost. And other thing is meditation, laughter yoga, smiling all the time, not to think. And we do so much emotional effective therapies like we do our fingers. So these are the gentle things to get my worry away, my anger, my bereavement, my sadness, my water problem, my palpitation. So these simple things we have learned from our friend Sam. So you should carry on these simple things. Don't worry about this strenuous exercise. They are not for us suffering from stress incontinence. No, they say even don't do jogging, fast running, and do laughter with precaution. So we have to be very, very careful. The next one is Bhamari Pranayam, which is a soothing pranayam. Get rid of so many problems. Can't sleep. That is another big problem. Good for hypertension, for heart, and increase the immunity also to fight against any foreign invader, whether that is bacteria, virus, fungus. We do 3 times. Udgit Pranam 3 times. The 8th step known as Pranav Pranayam. Prana means supreme power. Oh, we are in the stage of silent meditation. Fix your mind either on your breath or the third eye or any chakra of the body. Go on chanting inside. Whatever you practice at home, any mantra, any shabad, any dhun, carry on. And we are at the stage of gratitude also. Thank giving to Almighty. मैं अकेला नहीं हूँ. I am never alone. The supreme power is always with me. I am thankful to Almighty who gave me strength to perform today's yoga. उस प्रभु का कोटि कोटि बार धन्यवाद जिन्होंने हमें शक्ति प्रदान की आज के योग अभ्यास करने की. Thank you, thank you, thank you. Raise your arms up, rub your palms, put the palm on your eyes. Slowly open your eyes, move the hand. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashantu, ma kashtit dukha bhag bhavet. Om Purnamida Purnamidam Purnyat Purnamudachyate Purnasya Purnamadaya Purnameva Vaishishyate. Hari Om Tat Sat. Hari Om Tat Sat. Hari Om Tat Sat. Om Shanti Shanti Shanti. Thank you very much, my friends. You can ask me any question if you want.
Dr. Kapurji.
Something is not clear.
Dr. Kapurji, I've got an incontinence problem, plus the heart problem, and I'm taking water tablets, furosemide, 80 milligrams. Will that make my muscles weaker, pelvis muscle weaker?
Oh, no. It doesn't make your muscle weaker. It makes you go to toilet. That's why people arrange the timing of taking these tablets for blood pressure, you know. It can be anyone. No, it doesn't make your muscle weak. Never. Only the muscle is being weak because of our age and not doing any exercise in pranayama.
It's true.
No, that drugs doesn't. There are another tablets. There are another tablets which can cause for the hypertension treatment that can give you complications. So please always get the advice of your physician. But don't panic if you are. Please never stop your medication. Never ever. Follow your doctor instruction. If you do your physical exercise and some of the poses I have shown, and all the steps of pranayama, concentrating more on Kapal Bharti, Bahiri Pranayama, Agnisal Kriya, and Ujjayi also, because that is good for weight balancing also, and for heart. But that won't give you. You are more going to the toilet if you take the tablets at the wrong time.
That's right, yes.
Late evening you take, you will be running in the toilet. That doesn't mean you have got that problem. That is the problem of the drug which is you are taking. So this can be caused if we don't instruct the patient properly, what time to take the medicine.
I take one in the morning.
Do your exercises, be happy, be cheerful, and what poses I have shown, whatever you can do it. And you will be much better. I have seen it in my classes.
Lovely.
But again, one thing very important, you have to continue that pelvic floor exercises. Don't stop it.
No.
The effect will be shown if you repeat 4 to 5 times a day and repeating those 2 exercises, pelvic floor, maybe 6 to 7 times, one go, then rest, then repeat the whole day 4 to 5 times. And the best time is, we remember when we go to the toilet, we remember. Or when you're going to bed, you remember. Or you set your own clock, what time you want to do. Effect will start after, in some cases, 6 to 8 weeks. And in some, it takes about 3 to 6 months. But if you stop those exercises, that condition will come back again. This is lifelong. Lifelong, you have to do this pelvic floor exercises.
That's very true, very true. Thank you very much. Thank you.
Who was the lady who requested this? Urinary incontinence. Don't feel shy. It's nice to know who has requested, because these are the very important problems we are suffering, for which we don't talk even, embarrassed. So I'm very grateful to the lady who asked this subject. That makes me to learn again and be a student again. And I share what I have learned with you today. If you have any doubts, any question, please you can ask me. And please let me know your next subject you want to listen. It's nice to do these topics because it's very difficult otherwise. Doctors are doing very well. They are doing very well. I am also retired general practitioner. But again, how much time they can give you? They have got enough on their shoulder. So if I can help little after my retirement, I think I'm very lucky, and I'm very, very grateful to you people all.
You're doing a great job, Dr. Kapurji. You're doing a great job.
Yes, thank
Doctor,
you.
we're very
Thank you.
lucky. Okay,
You
you've been trying to help us a lot. Thank you so much.
Can I add something? Can I add something
Thank you,
to
thank
what Dr. Kapur has done today? There is a gallbladder meridian that goes from your ear, if you take your glasses off, from here all the way back up to the back passage to the middle of your thigh, leg, right to the heel. So if you press this point and tap at the back all along your spine, that itself will make your bladder in meridian channel will open up and your bladder will work better. Just tapping right at the back. That's what we do with the Mandukasana. I was trying to do that for improving your digestive system. Just something very simple and very effective. You know, just thought I just add that bit of kind of acupressure bit onto that. Okay. Thank
For
you very
men
much,
who
Dr.
have
Kapur.
weak
Thank you.
partner, then what?
Ramanji, thank you.
Have a
Thank
lovely
Thank you,
day.
Dr. Kapur.
Thank you.
One thing I forgot to tell you.
Radhe, Radhe.
Radhe, take care, everybody. Take care.
Thank you.